Today I'm going to share our cultural presentation on the Native American population. This presentation was put together so we can provide culturally competent care and have a better understanding of the Native American population. The model that we chose for our transcultural theoretical framework is the Purnell model. The Purnell model was created by Larry D. Purnell, and this model is used with the purpose to organize the framework to learn and understand cultures. Now, this model is used and works well with different types of healthcare settings, and it also covers various cultures in order to get into the deeper root of the culture. Now, it begins with the outside, and on the outside it has the global society. And as we work towards the inside of this circle, it will become more personalized, going from global to the community, to family, and then to the person. And within the person, you're going to get the 12 domains of culture. And these are going to be the specific things to that person that is within their culture. And as we know, cultures have also become more meshed. So sometimes you're going to have parts from two separate cultures within that one person. Now, if we look underneath the circle, there's going to be that sawtooth line. And below that are the stages of competence. Now, there are different levels that you can be at. You can be unconsciously incompetent, where you're not really aware that you're lacking in any awareness of another culture. We can be consciously incompetent, where you're aware that you're lacking knowledge, but you're not particularly doing anything. We can be consciously competent, where we're taking the effort, learning about another culture, and getting the information so we can use it for our healthcare settings. And we could be unconsciously competent, where we just provide good healthcare regardless of anybody's diverse background. Now, as we get into the Native American population themselves, we'll start off with the demographics of their population. Now, Native American is a very blanketed term. It covers the American Indians and Alaskan Natives. For the most part, it will be the people that were original to North, South, and Central America who maintain tribal community affiliation. Now, there are over 566 federally recognized tribes, each with its own culture, belief, and practices. As I said, the word Native American is a very blanketed term. There are tribes here listed with over 100,000 or more people in the tribe. Now, the top states with Native Americans and Alaskan Natives are Alaska, Omaha, New Mexico, South Dakota, and Montana. In the Native American population, we have 10 leading causes of death based out of 2010. These causes are cancer, heart disease, unintentional injuries, diabetes, chronic liver disease and cirrhosis, chronic lower respiratory disease, stroke, suicide, nephritis, nephrotic syndrome, nephrosis, influenza, and pneumonia. Now, there are also some health issues that correlate to those causes of death. The health issues I have listed here are teen pregnancy, infant mortality, HIV and AIDS, obesity, diabetes, mental health issues, alcohol use, smoking, and tobacco. Now, there are contributing factors to these health disparities in the causes of death. Historically, we've had conflict between the Native American population and the U.S. federal government. Now, although there have been treaties signed and we have attempted to move forward, there are still some issues that still remain. IHS is also available now for Native Americans that live on the reservation. However, more than half of them do not permanently live on the reservation and may not even have access to transportation to get there. Geographically, this may be one of the bigger issues, especially in some of the more distant states. Also, with the distance, there's no follow-up on care. So we're beginning treatment and things never get finished and completed. Now, there's also issues with poor diet among the Native American populations, as well as smoking, and unfortunately alcoholism, which is why unintentional injuries would be listed, because alcohol would be the main contributing factor to that. As we continue through, we come upon education in the Native American population, And here we have a comparison with Native American populations having 82.2% of 25 plus year old people who have at least a high school diploma. In them, they then have 17.6% with a bachelor's degree or higher. In comparison to the U.S. population, we have 86.3% of the population had a high school diploma or higher, with a 29.1% having a bachelor's degree or higher. Now, as far as education, that is completely worked on by the tribal. Yes, the federal government does assist in that, but specific things are set by each individual tribe. Now, as this affects the income, the American Indian Native American population has a median income of $36,000, with the U.S. average being at $52,000. Their poverty level for the American Indian is at 29.2%, which is the highest of any race in the United States. The United States average for poverty is at 15.9%. Now, with health insurance coverage, the Native American population has 26.9% who lack insurance, with the U.S. average being at 14.5%. Now, this will also correlate with the previous slides of why there were so many different reasons for death. And if they do not have the insurance, they will not feel comfortable going to the doctor. In regards to religion with the Native American population, they do not consider their practices to be beliefs but a way of life. They are not included in any particular religion. There is not any particular day of the week that they find to be particularly spiritual. The natural world gifts such as plants, animals, clouds, and mountains are sacred and profound. Religion is the relationship between the humans and the world around them, from everything to flora to fauna to springs and lakes. Some tribes believe in a shaman who is responsible for overseeing Native American spirituality. However, each tribe will have their own individual practices. There will be similarities and there will be differences noted. Now, a similarity with religion is respect. Respect is the basic foundation to many tribes. One particular form of respect is the Sundance ceremony, showing its gratitude and respect for the bounty of the hunt, abundance of the earth, friendship, and for the Creator. Here again is another image of the Sundance. And then there's also an image of the rain dance, which is to praise the spirit creatures who have controlled the weather. Family is very important among the Native American population. However, family structures will vary very differently between each Native American tribe. Elders will typically be considered as a leadership, as age will help them have more wisdom to guide the tribe better. Extended family members are just as important as the rest of them. Mothers, aunts, uncles, cousins, grandparents, especially the grandparents because of their age. They all form a close bond as family, a community, and a tribe. As we continue through family, we go to pregnancy and childbearing. Native American women have a higher fertility rate. Now, for many women, this is exactly what they want because they want to have a large family. And this is their goal. Back then, there was no birth control available, so there was no limit to the family size. Unfortunately, present day, Native Americans have a higher prevalence of sudden infant death syndrome, as well as many children are born out of wedlock. To go further with the care of the children, they were raised with the freedom of choice. Parents were non-interfering, allowing them to choose if they wanted to take medications. However, even as non-interfering parents, they had a clear expectation of what needs to happen with the family. They were to help with daily tasks and chores, respect their elders, and taught the practices to respect tribal traditions. Extended family is often involved with the raising of the children, which is part of the phrase, "It takes a village to raise a child." As we continue, we care for the elderly who are the highest respected and treated with honor. As I mentioned before, their decisions and opinions are often greeted with great respect as they have wisdom that has grown with their age and experience. They're cared for at home in their later days and end of life, And they're not afraid of the end of their lives, as this is seen as part of the Great Circle. As we go through the family, we go up to the decision making. Family members tend to live within close proximity of each other. As I stated earlier, with families, extended parts of the family, such as aunts, cousins, grandparents, are very important, and they're also utilized in helping to raise the children. Tribal councils and elders are often sought out for advice, as they are typically older, and the older people are sought as people with respect and knowledge due to their experiences. Their advice is often very respected. Decisions for the tribe are made by the tribal council. And within the home, it is the women that tend to be the decision makers. As if we look into the past, we'll find that men typically went out on the hunt and were gone for longer periods of time, leaving the women at home to make the decisions for their particular family. Death is not feared in the Native American culture. It's seen as the completion of the circle of life, and that circle itself is a major symbol in the end-of-life death spirituals. They are run by a medicine man or a tribal leader. The departed may be dressed in fine clothing. They may have personal items left with them and gifts for the departed. Tribal rituals can vary greatly depending on the tribe that they're at. Here I have enclosed a picture of an air burial, which is one way that it's done. Now, with the different tribes, they may have different requests or different ways that they do things, specific time periods to have the body buried, and typically they will not have an autopsy or organ donation. In the Native American population, communication is also a very important thing. English is learned, however, their native language is also very important. They also believe the importance in nonverbal communication, and silence is valued. Here I have an image that depicts the different languages that are used among some of the Native American populations. So again, the term Native American does blanket the different tribes and their individual cultures that they have. Integrated with communication is space, time, touch, and vocal patterns. As far as space, they do not like to have face-to-face communication. Typically, you'll see them standing side to side. Now, direct eye contact can be considered rude or disrespectful. And when meeting someone new, they like to remain an arm's length distance away from the unknown party. As far as time, Native American populations live in the present, day to day. Planning in the future is considered foolish, and this may be problematic in society as they don't follow through with a future appointment, and they may not run on a normal time schedule. Touch is something that is reserved for more of a friend or an intimate person, such as a loved one. Handshaking has been adopted by the Native American population in traditional non-tribal settings. However, it is a light handshake in order to avoid imposing their energy. And as far as vocal patterns, they're typically quiet in nature. Pitch, tone, and volume are viewed as quiet in nature for proper communication among adults, and talking too quickly may be disapproved and may be a sign of disrespect. As in many cultures, nutrition has changed drastically as the years have progressed. In the Native American culture, we will start off with traditional nutrition. Back in the traditional days, as I'll refer to them, they survived off the land, hunting, fishing, and farming. Corn was one of the largest used commodities that was grown, as it was the most broadest form. It would be used in lime water to make dough, and they would also use it to make breads and porridges. Sacred and ceremonial foods included bear, organ meats, and blood soup. As far as blood soup, it was considered a meal at the ceremony of the Sioux and a celebration of Mother Earth. Wedding ceremonies. The groom provided the meat as a sign of the ability to provide for the family, and the brides provided the corn and or the bread as their way of being able to take this and provide nourishment from what has been grown from the earth. Wolves and coyotes were the only animals to not be hunted for food, as they are very sacred and show a sign of teachers and pathfinders. As we advance time to current nutritions, it does vary depending on tribe. It has become more modern, as many cultures have found. 90% of the Native American population do not have a healthful diet. Majority have high fats in their diet, and the Native Americans are 4 times more likely to not have enough to eat compared to any other household in the United States. And I have a picture here of fry bread. That is one of the newer additions that came from the Europeans. It is actually not part of a typical, traditional Native American nutrition form. Now, with nutrition, there are also diet-related health issues. These will include obesity, diabetes, and heart disease. And here I have the rates of overweight and obese males and females and Native Americans compared to all other U.S. races. And you can see that the numbers are drastically larger. And common deficiencies in diet include vitamin D deficiency and lactose intolerance, with 95% of Native Americans adults being lactose intolerant. Now, as we go into the health of the Native American population, they do experience a higher rate of disease and lower life expectancy than any other race in the country. Now, as we've gone through this presentation, we've also talked about their location being a problem and their issues with time. However, one of the problems is suicide rates and mental health. They are 3 times that of any other population. They are not getting their mental health needs met for whatever reasons are coming up. Alcoholism is a chronic problem, and is part of the reason there is an increase in suicide, domestic violence, and fetal alcohol syndrome, as well as other health issues. Methamphetamine use is a top concern among Native Americans. It leads to aggression and self-harm and/or suicide. Mental health services are just not adequate for the Native American population. Mental health issues are a major concern. They're poorly funded and understaffed, and it is a difficult problem, especially when you cannot get them to come back in or appointments do get missed. And sometimes the staff that they go to see are not understanding of these issues. Now, they've tried since the early 1980s to have more focus on health promotion and tradition, running as part of health, avoiding alcohol, and more purification ceremonies. Indian Health Services is available with the goal to ensure that comprehensive, culturally acceptable personal and public health services are available and accessible to all American Indian people. Providers are oriented to their traditions in medicine. The services are available to Native Americans. It is federally funded and is allowed to discriminate in hiring Native Americans, so that way they have preference to have someone who is of their own culture taking care of them. In this slide, it's simply a map that shows Indian Health Services by population by area. Now remember, although there are large populations of Native Americans in some of these areas, they may not have the ability to get to some of the locations to receive the adequate health care they need. Now, to define health among the Native American population, we need to go with traditional beliefs. Total harmony with the nature and having the ability to survive under exceedingly different circumstances. A state of harmony with the illness. The human body needs to be respected. Illness may represent the violations of tradition and involve supernatural imbalance of harmony. Each person is going to be responsible for their own level of health. With health practices and practitioners, hospitalization is used for illness only, and women may choose to not seek prenatal care. This is due to the fact that women have been having babies for many, many years, and women may feel that this is something that they can handle on their own amongst their own family. Western medicine is acceptable in varying amounts dependent on the tribe. So some tribes may not allow for you to go see a particular doctor, or another one might. It's going to change in between each tribe. And now there's a mix between Western medicine with traditional practices. This is something we see among a lot of different cultures where they're taking the old and the new. And we need to make sure that we do not have any unhealthy interactions between the two. The Great Spirit gave the gift to the healers to help mediate between the spirit world and the earth. And it's those mediators that these Native American populations are trusting. These healers are the ones that are talking to both. So to learn what the mediators for the tribe believe is going to be something that would be very assistive in trying to get our patients the best health care they can. As far as the practitioners for the Native American culture, there are medicine men, women, shaman, singers, and healers. They are the traditional healers. They are wise in the ways of land and nature. They know the interrelations of human beings and the universe. They are expected to diagnose, prescribe, and treatment regime for the health. They perform special ceremonies to determine the causes of illness. Treatment is not only for the body, but it restores the mind as well. They promote activities to encourage self-discipline and self-control. They include acute body awareness. They use powers against enemies, herbals, rituals, songs such as drum and dance to cure the illnesses. They focus on the prevention, treatment, and health maintenance. Here I have a picture of a medicine man. And a quote, "A young patient observes a medicine man on the right and help her prepare a sand painting as part as her healing ceremony." And this is a Navajo Area Indian Health Service. As we go through health practices and practitioners, purification rituals will be done in preparation for meditation. They can do immersions in water and sweat lodges. Native American healers can be divided into 3 categories: working with the power of God, working with the power of evil, or working with the power of both. Some have the knowledge of herbs and or manipulations to rid the bodies of evil spirits. Drums are also considered another form of healing, and it also includes drumming, rattling, as well as singing. In this slide, you see a sweat lodge that is used for purification, as well as a drumming ceremony. With cultural sanctions and restrictions, alcohol is illegal on most reservations. It is bootlegged and purchased off the reservations and is sold at very high prices. And with alcohol, it can cause you to not be able to participate in certain activities such as a sweat lodge because of the fact that you have that still in your body. And they're also told not to take more from nature than is needed. They're educated to just take what is needed in order to survive. They hold nature at such a high regard that it is very important to not abuse the world that is around them. At this time, we're going to go through the evidence-based practice article that we found, which was Health Education Interventions Among Native Americans, a Review and an Analysis. This is a study of a systematic review of health education interventions among the Native Americans that address the prevention and management of chronic illness conditions as well as preventative health behaviors. It reviewed a total of 19 studies, 12 chronic illnesses, and 7 on prevention. Information extracted from each article included a sample, study, design, intervention, cultural relevance, and evaluation. Summaries of information collected on the effectiveness of health care interventions among Native American among 4 common chronic illnesses. These illnesses were diabetes, which are goals noted to increase knowledge and awareness of the community and educate about the care and increasing exercise, attempting cultural relevance and incorporating input from the tribal healthcare leaders and healthcare personnel. Coronary heart disease. Goals were to increase knowledge and reduce contributable risk factors. Use traditional foods and exercise, such as running, to reduce controllable risk factors. Use tribal figures as a fitness logo. Use competition between groups, community-based motivation. Used a combination of elder education and American Indian health educator. Substance abuse. Peer-managed self-control system with weekly classes. And they had positive outcomes with peer relationships, empowerment education, self-awareness, self-esteem relationships, decision-making skills, and chemical use. And fetal alcohol syndrome. Many types of written education tools distributed to the schools and clinics. Information written in both English and native languages. Combination of trained tribal and school employees to provide this important education. Again, as we talk about information collected to help with interventions for dental disease, prenatal and infant health, nutrition, and HIV prevention, the biggest thing that we can do is education. We need to make sure that we're educating in manners that are easily accessible and available, such as having mail dropped off or different types of contests or other positive ways to get people involved. We need to make sure that we're working together for breastfeeding, non-smoking campaigns, and working with the tribal leaders to have them educate, and working with however each particular tribe decides to receive their health care. Working with nutrition, again, with the tribal leaders, making sure we're color coding foods and things are culturally adapted and language free with typical graphics that are easy to understand. And with HIV, we need to make sure that we're going to do door-to-door distribution, posters, community groups, multilingual information, and definitely support from the elders. The tribal elders are going to be one of the largest resources that are going to be available to get this information out and understood and accepted. A large part of the interventions that they're using with the Native American culture on chronic disease is the use of the tribal elders, who are highly respected because of their knowledge. We're going to make sure that we have them promote the traditional family teachings that they tie so dearly to. We want to make sure that they're out in the community using traditional feasts and powwows to promote health. We want to make sure that they're implementing health education. And all of this needs to be community-based, specific to the culture that is there, specific to the tribe that is there. We want to make sure the interventions that come up are specific to the population that we are dealing with. For our second article, we did improving health promotion to American Indians in the Midwest United States, preferred sources of health information and its use for the medical encounter, non-experimental, observational, cross-sectional study, community-based participatory research approach. This study explored commonly used resources of health information, preferences for information presentation, and the use of health information prior and during medical encounters by Native Americans in the Midwest. Over 900 American Indians from the Midwest region from May of 2008 until April of 2009 were studied. 207 from powwows in Kansas region, 211 from focus groups, 124 from health fairs, physicals, 275 from career fair and conferences, and 181 in various other events of referrals. As far as results, we're seeing that the internet isn't a primary source for some of the Native American cultures, but the ones that have it enjoy it. We need to make sure that we're encouraging it in the populations that have it available. We need to make sure that we're encouraging them to talk to the pharmacists. We see pharmacists about once a month to pick up medications, and typically those are more frequent than when we see the actual provider. That would be an opportune time to ask questions. We need to make sure that we're using preference for pictures and methods to show them more culturally competent information, but we need to be careful that the use of words and numbers may or may not be the best for the graphics available. We need to make sure that we're targeting health campaigns for each Native American community. Remember, they're all different, so we need to make sure that we're going by each base community and what their needs are. And we need to make sure that we have them bring the traditions and work together to find a treatment regime that's going to work the best with the old cultures and the new Midwestern medicine. For nursing considerations that we're finding among the Native American population, they really don't like to wait in the long lines. The greeting with the handshake and touching are rarely done and shouldn't be initiated by us. Avoiding the direct eye contact and also remembering the arm's length apart from each other. We need to make sure we ask them about their traditions and make sure we listen. We need to be able to know the difference and not assume that they're all wanting the same thing. The ability for a person to be able to listen and hear what's being said. If they're telling you a personal story, it's not for you to tell others. And it's not polite to say, huh. We need to make sure that we're being open and using our abilities to reciprocate when they're talking to us and say, I beg your pardon. Note-taking is often considered taboo, and it may be better to use memory as a conversational approach, and it may entice more openness. Native Americans are modest people. They don't like to share personal information. They don't like to be exposed. We need to make sure we're gaining our patients' trust and respect. Physical exams. Make sure we provide them the privacy that they need before we expose them, and make sure we talk to them before touching them. Take care to keep their body covered as much as possible. They may prefer same-gendered nursing staff or physicians. Male may prefer male, female prefer female. And we need to make sure we're showing all family members a very great level of respect. As we've talked about earlier, family is very important to the Native American population. If they're coming into the hospital, they may be bringing sacred items that they want to keep on their person at all times. We need to be mindful of these and not touch them, such as stones, antlers, feathers, furs, claws, pouches, cloth, or leather. If the family is performing a ceremony, we need to make sure we provide them their privacy unless we're asked to stay. Make sure we ask before we take pictures, x-rays, CT scans, etc. In the case of an amputation, make sure to ask about their tradition and requirements after removal. Some may want the part blessed and then cremated and buried with the person upon their death. Some may require the part to be buried right away. So we need to make sure we're asking them what their cultural traditions are with any body parts that are removed. With pain management, they may deny pain as it's something that they accept as part of their body healing. They may be afraid of the medications, addiction, especially if they've seen it happening where they currently live. If a patient's end of life, they may deny pain meds so they can be clear-minded when entering the spirit world. They may not believe in the medications. They may believe they'll be healed by their own traditions rather than by Western medicine. So we need to make sure that we're having these conversations with our population and knowing what they're going to want and how we can best fit their culture into their health care. We also have smudging with sage, cedar, or sweet grass. This involves spreading of smoke over a person, place, or object for purification, and usually involves a feather for spreading the smoke. And this is something, do we have a place that we can do this in our facility? Are we able to offer them to have this? Tobacco tiles, small bundles of tobacco tied to the branches to carry prayers, are also different things that we need to be aware may be coming with our patient when they enter our facility. Again, being aware of what your facility can handle. Pipe ceremonies done by spiritual leaders, either in the room or outside the hospital. Stones and crystals to be laid on the person or held for prayer. And these are things that we need to be mindful of, that they're not rocks or anything that needs to be thrown away. So always making sure you talk to your patient, finding out if they brought anything into the facility with them that is important, such as these things.